There you go. Okay, now I can start again. We're grateful for NTAC for hosting the family exchange and having our Bridget here is our person with all the knowledge of how to the electronics and our support person. So thank you for being here, Bridget, and reminding me of the things that I keep forgetting. So if you'll go to the next slide, Stacy. So this is just a disclaimer for you to know that this presentation is prepared for NTAC under a cooperative agreement with SAMHSA, and all the material in this presentation, except that might be copyrighted, is for public domain and can be reproduced without any without permission from SAMHSA or the authors. Citation, if there is any in this slide presentation, you'll notice it, but I don't remember there being any specific ones in this one. So this event is supported by SAMHSA and the Department of Human Services as an award to NTAC. So here's some, Miriam Delphin Rittman was the assistant secretary at the time, and the contents are not necessarily that the views of SAMHSA nor the endorsement by SAMHSA or the US government. It's our information, right? Okay, next, please. So just in case there happens to be a security issue with this connection with Zoom, we will discontinue this Zoom link and you'll receive an email with further instructions of what to do. That's never happened to me, but I have heard it happening to others. So it's a possibility. So it has to be discussed. So next, please. A little bit about the NTAC overview. Next slide. This is the multidisciplinary team that works with and works in NTAC to provide information to system of care communities throughout the country. You can see it's a wide variety of agencies, including family representation through FREDLA and youth representation through Youth Move National. Okay, next. So the goal of NTAC is that all children, youth, young adults, and families with emotional or behavioral health needs can access evidence-based treatment and recovery services in a well-coordinated system of care. Next. You can see these are the types of audiences and the people that we serve. We have all kinds of resources for all of these people. If you are involved in a system of care and have a specific need, there is a slide at the end of this presentation that will give you a website to go to where you can request those free services. Next. And these are kind of the services that NTAC prepares and is ready to present and to give to you. It's no cost. The training, none of our training is at any cost. None of our technical assistance and none of our resources will cost you any money. So if you have a need, please feel free to reach out to NTAC and they will put you in touch with the right people depending on the question that you're asking or the services that you need. Next. Today, our presenter is Stacy Morgan. She's with the Mental Health Transformation Alliance out of North Carolina, and I'm going to let her do more of her own introduction. I just want to go over the agenda quickly, and then I'll turn it over to you, Stacy. So if you'll do the next. So we'll do our welcome and introductions. These are the things that we'll be covering in the presentation today. And we will do a debrief at the very end just and talk about the next meeting. So if you have any questions, feel free to use chat and I will be monitoring that as Stacy's doing the presentation. So then the next slides are yours, Stacy.
Thank you so much, Lori. I appreciate it. And I am so glad. Let me see if I can get this to change. There we go. I am so glad I get to be here with everyone today. Today, we're going to kind of talk about family voice in the ever-changing environment. And again, as Lori said, my name is Stacy Morgan. I am the executive director of the Mental Health Transformation Alliance, which is a 501c3 family-run organization with a state and national focus, the state being North Carolina, and national. I have a couple of national programs within MHTA, which I refer to it as for short, that have a little bit of a national focus. I am also, the parent of children who, and now young adults, who have navigated services and have been doing this for forever, it seems like, but for 20 plus years. And so today, as we go through this presentation, we're going to kind of talk about, that family voice. And what those different levels are and how to utilize those different levels, right? And then what are the benefits of having those different levels of family voice? And some of you may already do this, and some of you may already this be like an aha moment, like, oh my gosh, I should, yes, we can do this, right? So if this is just an aha moment for you, that's wonderful. We're glad you're here. So don't think that you have to be doing this right now to be participating in this. So I'm going to kick y'all off just right out the gate with a test, right? We're going to do this periodically throughout the presentation. So do you have a family engagement plan or a plan to incorporate and promote family voice at all levels of programs, policy, and processes? So for these polls, we're going to utilize the chat, and this is a yes or no answer. However, if you do say yes, can you give us an example of what that family engagement plan is, or how you promote that family voice? We don't need a book, so we don't need you to sit there and like type forever, but could you give us kind of an example? Let me see here what we got. So no, okay. I've got some no's in there. So, and someone says they're working on it. Okay, all right. And so creating a plan. So there's a lot of you that are in the initial phases, and a lot of, yes, Michelle. Michelle, can you, okay, here's Amanda says, yes, we have a monthly support meeting and a family engagement night with activities. Okay, monthly family council. So yes, so there's some yeses and some nos. And these are a lot of wonderful ways to, promote voice at all levels and have that. And then some of you say not yet, but after today and seeing some of these things that are already being instituted in other areas, then maybe you can use some of these. And then yes, I have a family advisory council and a family engagement subcommittee that has families and partners at the table. Awesome, awesome. Okay. All right, you guys have passed your first test. See, that's pretty painless, right? Pretty painless. All right. So consider the possibilities, right? Using representatives from like a lived experience populations, right? It's been on an upward, hill evolutionary process for over decades, right? And there's been an increase for family voice and family engagement. And requirements for funding sources, right? SAMHSA requires, family voice and family participation on their grants. And that needs to include, peer representatives. And then there's been a shift towards more of a family-driven approach to serving those vulnerable populations. And this is driven towards a growing trend to have an authentic voice at all levels of programmatic policy and practice, because there is multiple benefits in having that authentic voice. And when I say authentic voice, I mean authentic voice of someone who's actually navigating services currently or has in the past, or someone who, you know, represents that population. So what are those benefit examples, right? So these are just a few. I didn't want to go over every one of them, but families serve as a reality check for programs, right? Families are out there and they have or are in the process of navigating services and seeing what works for their families. So they know what works and what don't work. Now, I want to remind you that just because one thing works for one family doesn't mean it's going to work for another, right? So we need to make sure that we're flexible. Families can also validate the differential between perceived and real needs. You know, we as being on this side of the lens can think we know what a family needs, but they only know their real needs. Diverse families bring new perspectives to the table, right? So making sure that you have that diverse representation of families, and that just doesn't mean authenticity. That means if you serve statewide or different kinds of communities, it's also remembering them rural and urban communities. You need to remember that those have their own communities and their own culture. So making sure that those families are diverse across your table. And families can help sensitize agencies and organizations, state leaders and legislators. And we'll talk about that a little bit more coming up. And families often can advocate in ways that agencies cannot, because a lot of times families can say things and advocate for things that agency individuals' hands are tied because of policy or politics. Maybe they understand where the family is coming from on the way things need to be, but aren't able and flexible and free to say anything, right? So what are those? There's really three different, and I've mentioned family driven, but there's really three different levels of that family voice. The first one being family driven. And family driven meaning that families have that primary decision-making role in the care of their own children, as well as policies and procedures governing that care for all children in their community, their state, tribe, territory, and nation. We're going to focus a little bit on this today of being more of the family driven, talking about how that family voice fits into policy and what that looks like. Family involvement, meaning that, you know, families receiving those services are supported and prepared and offered the opportunity to participate at all levels, especially in that planning and implementation and the evaluation of the programs that are serving them. And any services that they're receiving along with those policies and those practices. And then there's the family engagement. And that's where this area encourages families to be involved with that child in services. And then also asks them, you know, encourages them to be involved with other families, right? Leadership opportunities, networking opportunities, you know, providing those opportunities for families to get that family engagement. And some of those things that were said in there, such as, you know, the family nights or the family advisory or family involvement boards, those are all networking opportunities for families. Even though they might be helping you have say on your policies and procedures and what works and doesn't work, those are also networking opportunities for those families. And then this family engagement also ensures opportunities for involvement in all those levels. And this is just a reminder, as I go through the slides and I say family voice, I want us to keep in mind that family voice, the hugest impact and the most beneficial and the best practice is to ensure that they're authentic. So when I say family voice, I may not say authentic in front of it, but authentic is what I mean. And we need to remember to stay in there and remember that anytime we receive input or we have families input or voice, that it is authentic and a good representation of our program or community. All right, so here's another test. All right, do you have a mission? And again, utilize the chat. Do you have a mission for advocacy and education in a place that includes family voiced or lived experience stories? And if so, just give a quick example. So do you guys have a mission for advocacy and education in place? Anybody? And if you don't know, there's no wrong answers in this. Yes, okay. And someone said it is part of our organizational mission. And then someone said it's in our wraparound meetings. Yes, but could use some improvement. And then someone said don't know. Okay, all right. And like I said, there is no yes, and families are part of our board. Awesome. Don't know. And a lot of you, if you don't know, this is a good question for you to take back to your leadership or whoever it is your supervisor is or your partners and say, do we have this? Do we have this? And if not, can we look at some other best examples that's used across the nation and kind of implement this and make sure this is included? Part of our mission. Okay, awesome. All right, it seems like a lot of you do, and some of you don't. Like I said, no right or wrong answers, but as we go through this, take these questions and take them back to, and ask them. Ask your leadership or your supervisor. And you can keep on putting stuff in and Lori will see it. And if there's anything, Lori, that pops out at you, just let me know, okay? All right, so storytelling, I'm going to talk about storytelling, but storytelling, when I say storytelling, I mean family voice and using their stories and experiences to affect improving services or policy change. Go ahead, Lori. Did you want to say something?
No, that's not for
What?
me.
I know, Millie said.
Okay. All right, so the value of storytelling. Storytelling is vital to human experience, right? It allows us as individuals to hear or accept with greater ease by more effectively linking the information that we're being told or the information that we're being given to our feelings, right? To our feelings and then to our thoughts, instead of to our thoughts and then really, it usually never makes it to our feelings. So storytelling helps us make that connection, connects people, right? It puts a face on something that has or is happening, right? So if there's a situation happening and a family is there to share what worked or what didn't work for their family and what could be improved, then that person that's being told that story will then remember the family that told that story and be able to link, okay, you're right, and then stories add an element of fact or fiction to our lives. So stories help us build a connection. It can help us build partnerships. It can help us build collaborations. And no matter who you are, everyone has a story. It don't matter if you're navigating services or not. You have a story. It don't matter where you are. You have been places, and we go on vacation and we all come back and want to tell everybody our stories, right? It is your choice, though, of that story, what you share. You don't have to share your whole story, and you don't have to share all of your story, right? There are several levels of this family voice or storytelling that can be utilized, and each level of focus, like each of these levels, will depend, which one you use will depend on what situation you're in as a family, number one. So if you're a family member, it'll depend on what the need is at the time. And if you're an agency or organization who's utilizing a family, then it will depend on what your need is, right? So that individual focus, this level focuses on the family and the family story. So like it focuses on that only. And then change focuses on that process, policy, or program, so that by storytelling, it can initiate a change or have a positive impact or a positive outcome. And then the presentation level, it accommodates, you know, the participants' expectations and needs. So if you're going into and you ask a family member to present alongside you as an agency, the outcomes are what it is the audience is expecting, right? So today you guys were expecting to learn a little bit about, you know, family voice and how that impacts policy and change and what that should look like. So that presentation mode accommodates the participants' expectation and needs. So I want to take just a minute, and this isn't a poll, but I would like you to put in the chat, you know, for the individual's focus, when might you use this storytelling or family voice technique? So if you're a family, tell when you might use it as a family. If you're an agency or community representative, when might you utilize an individual focus family story? Okay, anything? Telling about the work we do, okay. Engaging of new clients into service to bring a report to life, right. To help a family in a similar situation, yes, that is correct. Okay, asking for funds for, showing outcomes to funders, yes. Help others understand legislative hearings, yep. And when speaking for systems change, that is correct, correct. So that individual focus has a direct impact, right? So that individual focus has that direct impact. So the next, and every time I click on the chat, I gotta get my cursor back. So there are multiple approaches to family voice and storytelling. And just as there are, you know, several levels of that focus, there's also all these approaches, right? So these approaches include the Magic Minute, which this is telling your story or having the family tell their story in a minute or less, right? So that's like an elevator speech. Like, you know, you're in an elevator and there's someone has gotten on that you really were waiting to talk to tell your story to. So you got to do it in a minute or less. You got to get that out there. There is the written one-pager, where you can write the story and it be a one-pager, you know, because a lot of times, a lot of people don't have a lot of time to read stories. So there's the written one-pager. There's the letter. There's the 3-minute testimony, you know, someone said a minute ago, impacting legislators. And this is often, this 3-minute testimony is often used for testifying before the legislature or other elected bodies, right? And then there's the book, or a short video, right? So a short video, just capturing that story, and then that story being able to be shared with multiple people. And then the book is more in depth. It gives an overview of the story, but it also gives a deeper dive into that family's life. And again, you know, these multiple approaches depend upon, you know, the purpose, the situation, the style, and the time. And if you're a family, you know, this also depends on what you're willing to share of your story, what you're being asked, right? And if you're an agency and organization, it depends upon what level the family is willing to share their story, number one, and what your need is for your outcomes, right?
So Roxanne put in chat that she puts family stories in the newsletter.
I love that.
I do too. I thought it was a great way to share.
I love that. I don't know if it was quarterly or monthly, but each newsletter having a different family story. If families read that and community partners read that, having family stories, whether they're success or barriers, or, we're still working on it, right? Helps connect and bring things to life for the community. I love that. I love that. So how does that advocacy and storytelling fit together, right? So advocacy is to defend or promote a cause, and it is active and not passive, right? And advocacy goes beyond changing or shaping legislation or policy, and it has a larger goal of systems change. Bringing storytelling into that lets the policymakers or the people know that you have invaluable expertise and perspective on what it is you're advocating for, right? It also brings out empathy and a better understanding of the issue. Where up there it says advocacy is active and not passive. You can still be active, but bring empathy and a better understanding to the situation. And then storytelling also helps a policymaker remember your call to action. And again, when a policymaker thinks, oh gosh, I just talked to a family like this, right? And so they'll automatically hear this issue, and you will pop your family or your story or your agency that shared this or organization, they will pop into their mind. And again, they'll think with their heart there, right? Because we connected and developed a relationship and a collaboration or a partnership with them instead of thinking with their head. They'll think with their heart first and not their head, and do what's in the best interest of whoever they heard the story from.
So sometimes before you have to know what you're asking for. It has to fit with something that they're working on. Otherwise that connection won't be made.
Right.
In our training in Utah, we always use the KISS principle, which is keep it simple and short. I know other places say keep it simple and stupid, but that's not what I meant. Keep it simple and short. So as long as you're keeping it simple and short, and you know what you're asking for, because legislators who don't have this experience don't know what to do with the information unless you give them an idea.
Right, that is correct. And that's actually one side I debated on deleting and leaving in here, and I actually deleted it just due to time. So I'm glad you said something, because when you go in to advocate or storytell, whether you're a family agency or organization, and organizations can educate, they can't, lobby, but they can educate. You want to make sure that the stories and the issue that you're bringing to this person is relevant, right? It's relevant, it's current. I can't say that, I couldn't walk into a legislator's office and say, yeah, 20 years ago, I had trouble navigating services for my child. So this Medicaid program, it don't work, right? Like, you want to use an authentic situation, an authentic story of what's current, and know that this person that you're speaking to has knowledge of this. And this is like on their agenda, or they have the right to speak and help institute change, right? So thank you, Lori.
Sure.
So why are family and the lived experience stories so critical? Because it helps others understand family's real needs, and it gives a snapshot into that family's life. It doesn't give the whole picture, but it gives a snapshot. And it gives a feeling of control or ownership for, families telling their story and being able to have a say helps them institute that they've helped make change, right? Their experience and what they've done has helped make change. It also helps create the big picture. Like I said, it doesn't give the whole picture, but it helps create a big picture, and it gives a voice and a purpose to that journey. And it ensures services are designed to be responsive. So having them at all levels of policy processes and practices ensures that those services are designed to be responsive to families' needs. So can any of you, and you can put it in the chat, can any of you think of any additional reasons why stories or family voice is so important?
And if you want to unmute and join that way, you're welcome to do that as well. Other families will not feel alone.
Mm-hmm.
Making that connection or a connection. I can't tell you how many families came in and said, we didn't know that other people were dealing with this too. So it's really important that everybody, that they have an idea that they're not out there alone.
Right. And so while you're inputting this piece, can any of you think of like any generational family stories that have been shared with you from when you were a kid till, now you're getting the full picture of the story because you're an adult and you can better understand that generational story that was shared to you when you were younger? Stories convey hope, and putting a face with the outcomes. Becoming an advocate of a healing experience. It's like the whole she could be your sister type of programming. Yes. Stories convey hope. Mm-hmm. And like I said earlier, it said, it helps the system and the services designed to be more responsive. I said that earlier that not all things are going to work for, not all things fit for all the same family. Each family is different, but it will make the system more family driven and more family responsive to families' needs, having this family voice. And somebody said to be relatable to our clients, but sharing our experience can help build empathy in the system as well, and hopefully be able to change hearts and minds. Yes. And helping families know that it is okay to not be okay. That is correct. And in the same sense, one of the things I say in one of my trainings is that as you go into work with a family, each family is a blank book. It's a blank slate, right? Because what you've just developed or worked with a family before may not work for this family, right? Every family is a blank slate. All right, and we're going to have another poll. So, and so you can continue to enter this, or like Lori said, if you need to come off mute, you can. Do you currently incorporate family voice into your program? And again, no wrong answers, no wrong or right. And if you do, how do you do that? So those of you that have those family involvement or those family advisory boards, what do you do with that? Like, what do you do with the information that you receive from them? Some of you are saying yes, okay. Yes. So what do you do with that? How do you incorporate that? Do you incorporate that in a plan? Do you take it back to leadership and make change? Do you take that information and share it with, policymakers? What are some of the ways that you do that? Report to the state and develop needed supports and education, take it back to leadership, okay? Yes, and each time someone is new that comes to our group, so they get to know us and get to know the new one. Awesome, awesome. And yes, we take the information to our county leadership team. Okay, awesome. Yes, and ensure that the summary and examples are included in the minutes and repeated in further policy. Okay. Incorporate in the treatment plan and refer the information to leadership, client advisory board suggestions, satisfaction surveys that are shared with leadership. So awesome, because a lot of times, you know, family voice, they share it and they don't see a lot of outcome, right? So you want to make sure that you're taking the information you're giving, because it's coming from, you know, wisdom and understanding of things that didn't work for them, and then and wanting outcomes. So making sure that they know what it is you're doing with this information that they're giving you, because they're sharing part of their life, number one. And number two, they like to see outcomes that will then help them increase their trust in you and their partnership with you, right? All right, these are all wonderful, wonderful ideas. So no matter how big or small or how short or long the story is, it can open doors for families, for organizations, for agencies, policymakers, for anybody. In what ways? So these right here, so family members, these are some ways that you can utilize those family stories. One, if a family doesn't feel comfortable in getting up and speaking, that's fine. Make sure they write it down, because there can still be an impact in their story, right? And you can get their permission to utilize it there. You can utilize stories, stories and voice, speaking at meetings and conferences. Like I said, that's that presentation mode, right? So what is it, the outcome of that presentation? And making sure that you're using an authentic representative that can speak to that. Talking with legislators or policymakers, again, that's where you get your huge impact, because policymakers and legislators can, you know, add a face to what it is going on. And talking to providers, even if you are a provider and you're on here today, talking to other providers of why there is a need for this, right? Talking with the media. Some families have told their stories to the media when it came to policy or legislation or services were not working for them. Then serving as a board representative, serving on your advisory boards, on your board of directors, on your just your involvement boards, and then becoming that parent peer support partner, or whatever you call them in your state, family partner, parent support, whatever you call them. Those open the doors, those stories, like someone said a minute, open the doors when working with other families. And then organizing a parent support group, the same thing. Stories help people who are in your groups or working with you, partnering with you, be more relatable, right? Like, why are you here, right? Like, why are you here? And then training, development, and delivery. Always make sure that, you know, if you're developing a training, it is best practice to incorporate family voice in the development of that training and the delivery of that training. And then participating in the development of policy at the local and state level. Again, they like to hear stories of what, even if it's not what's working, but, you know, like what is working and what isn't working. The elected officials like to hear that. They like to hear from their constituents, number one. And number two, especially if it's a big, like, it's a big legislation piece, before they make, you know, those huge decisions. And then participating in the development of resources that are going to be given to other families. And you need to have that that voice of families in the development of that. And so what are some ways, we're going to ask, you know, what are some ways that those of you that already utilize stories, or if you're a family, right, that you've used them to help others outside of the things that we said just a minute ago. Okay, so outside of engaging a parent, and there's some out of the box things that you've used them for. I see some in here from before, like such as speaking at a PTA meeting and having family members participate in quality improvement. Have you guys taken any families to speak with state leaders? Have you as families ever spoken before the legislature?
Now, I'll just say while you're thinking about that is I used to talk to the legislature at least once a year. And then pretty soon after about 15 years, it got really obvious that they needed to hear from somebody who had a fresher face than mine that hadn't been there every year. So I could participate with them, but I needed to bring somebody with me who had a new story to tell. So that was important.
Yeah, and you need to, in another training that I do, that is like, you always need to be cultivating new leaders and new families, because like I said, I can't come in and speak to what happened to me 20 years ago. I need someone who's going to be able to talk to the relevance of what's happened currently in the current environment. So that is true. You can, as Lori and I, can mentor and support those families and make sure, be a conduit for those family stories to get where they need to go, right? But yeah, they need to be, more current and always cultivating new leaders and new parents. So some of the things that were said in here.
One says mental health day on the Day on the Hill in Minnesota, which is awesome. We do that in Utah as well. The next one was we have parents talk to university students to come to our support group and observe. That is an awesome out of the box idea. I never thought of that. Used to bring family to our stakeholder meeting. Here we are in the developmental stage of creating a parent advisory council.
Awesome.
FTNYS, that's in New York, has a month of March dedicated to legislative advocacy. We're planning legislative breakfast in March in Western New York. That's awesome.
That is awesome. Those are awesome, awesome ideas and awesome ways to do that. And so, if you guys see someone put something in here today and you're like, oh my gosh, that would be awesome, jot their name down and see if, or private message them and see if you can't get their contact information. So
there was one earlier that said we ask families to review our brochures and get their input on our new projects. That's an awesome way to bring families in.
Yeah, that is. And I want to say why. You're probably sitting there saying, well, why have families review our agency brochure, right? Well, if we write it, and I've been doing this for 20 plus years, so I'm to blame for this sometimes too, because I'm like, it's a way I live, right? It may not be, I might be able to understand it, right? Because I live it every day, right? I live the policies and the practices and work it day in and day out. But as a family member who's new, just coming into services, may not. So making sure that family members can kind of look at the brochures and the resources that you provide increases your chances of engagement and outcomes with that family and making sure that they stay in services.
So we used to always think that there was no better advertisement or testimony of our program than somebody who's talking about it in a positive way. So, if we could have families come and talk about our program in a positive way to other people, then that was a better, I don't mean advertisement. What do I mean? It just is a better way to approach or to talk about our programs.
Like a face, like putting a face to the program, again, it goes back to connecting a face, a heart with the program or the story, right? Making it relatable, giving it normalizing it, right? Normalizing it. We talk about, this work not having a mental health not having a stigma. So it normalizes it, makes it easy, or like someone said earlier, telling parents that it's okay to not be okay, right? That there are other people out there like you that are having challenges and having to access services and resources. All right. All right.
So Christina said it's really important to teach families how to feel comfortable doing those engagements. I found that the sharing your story presentations fill up so quickly. I can't offer them enough. The funds just can't cover them. Families want to learn how to share their stories effectively, how to communicate with different audiences, and they are so used to being ignored or shut down.
That is true. They're so used to being, and these are a couple other slides that I took out, the barriers to getting that family story. They're used to being ignored. They're used to being blamed.
Blamed, yeah.
Yeah, they're used to being seen as tokens, or what we call tokenism, right? Like they're just there so you can check a box. Someone can get the funding that they need. And that's why I said earlier, making sure that you're connecting what you're getting and the experience that you're getting from these families with outcomes, and that they're seeing those outcomes, right? That you're not just, they're saying, hey, you need to make these changes on this brochure, and you just like, okay, we'll take that into consideration. Making sure that you're actually listening and doing that.
And you're covering all of the diversity of your state or your community. That is way important too, so that those marginalized communities feel like they can see that program working for them. So it's important to do that.
And when you do those videos, stories, collecting, or getting representatives, like I said earlier, make sure that they're authentic representation of the areas that you serve. So you might serve a wide range of areas. You might have an urban, and you might have a rural, you might have a tribe. Make sure you're including all of that, right? Make sure you don't just use one and you think it's going to work for everyone. Make sure you have a good representation from the individuals that you are supposed to. Even if you're not, say you're not serving, the western side of the state, but you do offer services over there. Make sure you're including that. Again, that normalizes that and brings that in, right? All right. So moving forward, right? So how do we make this work? So creating a shameless environment, an environment that is family-centered, if we apply family-driven practices, creates an environment of open, trusting, and collaborative relationships, right? It will make a difference, which will help you move forward and work within the partnerships that you have. It'll help you develop and implement a way of work, right? With those, a way of work, meaning how are you working with those family members, not just providing them services, but how are you partnering with them around the table to ensure those services are right? Creating a motto that carries a message of partnership and acceptance. Having those partnerships and those open communications is going to create a motto that, hey, we're in this, we're invested, right? We're here to partner with you to ensure that children and youth and families in your community, in your service area, have the best access to the best services that are available. And then if you also create that way of work and create that motto of partnership and acceptance, you can serve as a role model and a leader within your communities, right? Because you're starting a ripple effect of bringing that family voice in and working alongside those families and utilizing their expertise to make change. And then integrating that family engagement, family involvement thought into the delivery system, right? And as you guys, I'm not saying that you got to take 50 families every time you go to the state to meet with a state leader. What I am saying is that you can say in those meetings, look, I think you need to meet with so-and-so because they have some real life experience with this that I think you'll be interested in, right? So you're going up there and integrating that into that delivery system yourself, and then following up with making sure that there's a connection made between that individual and a family that's had authentic experience with that. And then make sure that you're establishing culturally and linguistically appropriate goals, policies, and management accountability, and that you infuse them throughout that organization's planning, right? It can't just be the stories of the families that, you know, you have that work for you, right? You have to make sure, again, like Lori said a minute ago, making sure that you have a varying representation from all of the families that you serve. And I said at the beginning, it doesn't just mean ethnicity. It also means the cultures of the communities. If you think about the neighborhood that you live in and then the neighborhood that's down the street, two different cultures happen within those neighborhoods, right? So making sure, I'm not saying you have to have a representation from every neighborhood in your catchment area, making sure that you have the urban and rural and ethnicity, marginal communities representation around the table, okay? And that you have their voice. And then utilize creative practices. I call them out of the box practices that really have never been tried again before, yet are within your agency or organization purview to be able to implement, right? And these could be these creative practices that could be utilized within the agency and organization, or these could be these creative practices that the families who can advocate differently than an agency or organizational person utilize, right? So they take that up and do that. You'll cultivate leaders that can do that. And then identify and develop opportunities for family engagement and voice. So in your plans, if your plan says we have family voice at policy meetings, have family voice on brochures, have family voice, you know, around the table, and you can go down that list of the three and say, oh, well, we already have all that. Okay, well, we're good. No, look around and explore where else. There's always a chance for family engagement and voice, always. It doesn't matter where it's at. There is always opportunity to have that family engagement and that voice. So even if you're checking off all the boxes and all the families sitting around the table are, you know, satisfied with what's going on, kind of dig deeper and see if there's something that you're missing. Do, what do they call it? A SWOT analysis, your strengths and where are your weaknesses, right? And assess that. Do you have family voice there? And make sure that you do. And then, you know, support the family voice and their partnership with agency staff, right? So make sure that you're having that support to develop that open communication with any agency staff, and it in turn will increase collaboration and engagement. And then define what support and educate, define and support and educate state leaders on families, right? And again, that goes back to where I said, you know, if you're up there and you're like, you know, hearing a situation that you feel that one of your family leaders that you have in your toolkit, we'll call them toolkits, right? You have these family leaders in there that you can pull from, you know, make sure that if there's not an opportunity for another meeting, that you get with that family and make sure that they're okay with writing down their story to share it, right? And to be able to share that, to educate state leaders. And then make sure involvement and engagement, and see how it fits into policy change or shifts. And that's just not at the state level. That's just not at the local level. That is within your plans as an organization or agency. Develop a strategic plan for family engagement and involvement, and make sure you're not just developing and putting it on the back burner. Make sure that you're continuously assessing and reassessing how you have that family voice in there, that it's not just written in there and it's as a tokenism. And again, establish those out-of-the-box practices that will engage those families and ensure that authentic family involvement. And then keep families at the center of policy change, right? It is not just about, we all are in this game together, and at the end of the day, we all want positive outcomes for families, children, and youth. That family wants positive outcomes for that family, children, and youth, right? So at the end of the day, make sure you're keeping families at the center of that policy change, and that they're able to have that input. And then focus on supports and changing state legislation and promoting best practices. And again, educating on those supports, giving them stories on them supports, and change state legislation and promote best practices. And then last but not least, this probably should have been first, and you've heard it as a theme throughout the whole presentation. Families are experts. They're experts not only in their families, in their communities, and in what works for them, but they're experts in what other families need that are like them, right? They may not have the PhD or, the letters behind their name, but they are experts, and their stories and the experience that they have been through serve as an impact for policy change. So Lori, we are to the, do I need to stop sharing? Do you need me to stop sharing?
Nope, not yet.
Okay.
So thank you all for participating, because your participation really makes a difference in these presentations. So we're going to break up and let you actually speak to each other for a few minutes. These are the two questions that we came up with that we think are important to ferret out a little bit. Where within your program initiatives or partnerships can you incorporate some of the strategies that have been identified today? And then how would Family Voice benefit your work or organization? Or how is Family Voice benefiting your work or organization? So Stacy's going to be in one room and I will be in the other. We'll take some notes, and then we'll come back together in about 20 minutes and just do a quick little readout or assessment of what we learned, and then we'll finish off. So
can I say something before they go? And this gives you too an opportunity for those of you that said I don't know or know in some of the answers. This gives you an opportunity to ask those that are doing it, how did you do that, or how did you start that, or how can I reach out to you to follow up afterwards too?
Very good. Yeah, thank you, Stacy. Okay, so Bridget, thanks everybody. Thank you. Thanks everybody for participating and being part of that conversation. Stacy, do you want to start by telling us what you learned in your group?
Sure. So, we had a lot of wonderful discussion, and we kind of tackled the first question, which kind of led into like I said a minute ago, if you're not doing it or if you're starting something up, what is it that you're doing? So it kind of led into that. So for the first question of where within your program or initiatives or partnerships can you or are you incorporating some of the strategies that were identified today? They talked about the ones that had shared, that said they had those advisory boards. They use those strategies. If they don't now, they can use them in their advisory boards. Someone talked about the family council, their family council meeting, where they get feedback, and they have ask an expert, and they have community and program representatives there for families to actually and youth to actually engage with, and asking real-time questions. So that's where they're incorporating some of them strategies that they learned about today. And then, there were others that are just starting something, or, and thinking about initiating something, and they kind of talked around, how they were doing it, who leads those, like who leads the family advisory board, who leads those. Do the families lead them, or do the agencies lead them? And this individual said that they serve as a guide, and that this is the family's advisory board. So we have a lot of good conversation that kind of stemmed off into other things. But yeah.
Yeah, good. We also had things that kind of ventured off a little bit. But first of all, that first question, where within your program does it help you? Michelle talked about using some of her success stories in her grant writing. And so that always helps to know, let the grant writers know that the work that you're doing is going to be helpful, and you're going to get good outcomes from it. So that was a good thing. We talked about using success stories, and Michelle also talked about a program that she uses for youth, a work readiness program, helping youth get paid to do some of their work, and how they benefited from that. And also using success stories to continue. She's going to be able to get funding to do that again this next year. We talked about how to get how to pay for them to be there. Where do we get that money? Networking and building relationships was a big topic. There are some stipends. I know every time we would write a new grant or write a new budget, we always put it a line item in our budget so that we had the money available for us. And then somebody suggested going to local groups like churches or other local businesses that might be willing to participate. And then finally, we had somebody share that they bring family stories into their staff meetings, because that helps to reinfuse that into their staff about the real work that they do and how important it is that they're doing that. And they know that everybody's doing that kind of work. So that was kind of where we had a lot of good conversation, and I appreciate everybody's participation in that. So we have about 5 minutes left. I have a couple of slides left to go through. So before we move on, does anybody have any questions or concerns or anything that was brought up about what you discussed that you want to have more discussion about? Okay. The other, next slide, please. I'm trying to change slides and I realized I don't have control. This is more information about mental health transformation, and it's how you can contact Stacy if you have questions about what you learned today and want some more information. When you were in an email that was sent to you to remind you about today's session, the slides were included in that. So you have a copy of the slides. But if you need to learn anything more about what we talked about today or what Stacy presented, feel free to give her an email or look on her website, or whatever it is that you do that you need to find more information. Okay, and we really want to thank you, Stacy, for your time and effort in presenting today. So thank you so much for your expertise and bringing all of this to us.
You're welcome. Thank you for having me.
Yeah, thank you. Next session will be Wednesday, February 22nd. And because you registered for this one today, you've registered for the whole year. So you'll get a notice automatically. But when you, if you have friends or other workers who want to participate, here is the link for that registration. I neglected when I sent this out to somebody. There is an underline at the very end of this that I neglected to put in. And if you don't put that in, it doesn't work. So there's an underline that's part of the underline, but it's underlined right there. Anyway, make sure you include that. And we're going to be talking about supporting peer parent support workers across multiple child serving systems. It's hard to be that, be expert in all of those child serving systems. And we're going to talk a little bit about how Kentucky does that. And the director and assistant director from Kentucky Family Partnership, they're going to be with us and they're going to help us learn more about that. So next slide. So we need to hear from you. It helps with our quality control. You'll get a survey in the email. It really helps us to know. We use that information to improve the work that we're doing. So please, when you get that, please send that, complete that survey so that we know what we're doing. Next slide, please. Here is the information I told you that would be at the end. This is all of the contact information for NTAC. If there's anything that you need services, technical assistance on, more information, please go to the email or the website or request TA through the TA Center, and they will make sure that they pass it out to the people who can best provide that to you. Next slide. And finally, SAMHSA's mission is to reduce the impact of substance abuse and mental illness on America's communities. We've heard an awful lot about that this year through our COVID and coming out of that COVID and what that did to the mental health issues that we have with young people. And so that it's really important. This work is really important. And you don't have to belong to a system of care to come to our presentation, but we're happy to have you. And thank you so much for your time and your efforts and being here and participating. And if there's anything that Fredla can do, please contact Fredla at fredla.org and we'll get with you as quickly as we can. So I will say thanks again to Stacy and thank you all for joining in, and we'll see you next month. Have a good rest of your day.
Bye, everyone.
Bye.
Thank you. Bye.